Dr. Boyer.
Hi, Kendra. What's up?
I just got off the radio with EMS. They're on their way in right now with a 24-year-old who was a motorcyclist who was involved in a down and under a semi-trailer, under a tractor trailer. He was unhelmeted. Right now, he's got some unstable vital signs. BP is 80/60, heart rate's in the 140s. He's breathing about 40 times a minute and has some really pretty noisy respirations. EMS has put an oral airway in, but they don't have anything else at this point.
Do they get IV in him?
They do not have an IV yet.
So here's the plan.
Okay.
Is first thing before this patient comes is we need to make sure we got everything ready. It sounds like this guy's got an airway issue, so we're going to need to set up. I see we've got our airway stuff here.
Right.
Let's make sure we get a crike set because
Okay.
it sounds like he's got some pretty bad head trauma as well. So when this patient gets here, here's the plan. We need to have a good organized team effort on this. First thing is we all need to make sure we put on our personal protective equipment. You said open femur fracture down here. He's not moving that foot, but he's moving the other one?
Correct.
And last blood pressure was 80?
88,
88/40, and he's tachycardic.
Correct.
Okay. Super. Anything else you want to tell me about him?
That's it?
Okay, thanks.
All right, thanks, guys.
Guys, let's get into action here. I'll tell you what we need to concentrate on. You're going to get a blood pressure for me. You hook over the monitor. I'm going to look at the airway here. You guys get that started. Let me see. I think I got my kit up here. Go ahead and bag him a little bit. You hook him up to a pulse ox while I'm doing this also?
Sure thing.
No, I'm not seeing anything.
I'll get the crike.
So, Kendra, do we have a crike kit? I think we're
I'll
going to
get that
crike
ready
this
for
guy.
you.
Okay, let's see. Okay, Cody, you keep his control there. Kendra, can you
bring
come over here
this.
and bag him? I'll get the kit
I
set up.
sure can.
Feel for the Adam's apple. Right below the Adam's apple is the cricothyroid membrane. We're going to make an incision. Down. Get a little blood there. We're going to use the back of our scalpel. I think I'm in the airway. Good. There's a little bit of air coming out there. And now we're going to put in a endotracheal tube. Actually, we have a tracheostomy tube here. Yeah, there it is. Kendra, can you hook that up there? What was his pressure?
He is now 80/60 still.
80/60 still. So
Heart
he's
rate's still
obviously
140.
probably bleeding somewhere. Let's give him 2 liters of fluid, wide open. You got 1 large bore IV. Let's start a second large bore IV in this right arm.
Okay.
The paramedic said he didn't have any pulses. Let me check those down here. Put some pressure on that for me, if you would, Cody. Thanks. Circulation, what's his pressure?
He is still 80/60.
80/60. And
Yeah.
how much fluid have you given him?
He's gotten the 2 liters of warmed IV fluid.
So he's not responding. Let's go ahead and give him some O-negative blood.
Sure.
Please give him 2 units of O-negative
Okay.
blood.
I
And you
just
can hang
got
some
2.
more saline while you're at it.
Okay.
Got our ABCs. Now let's do a disability exam here. So we're going to do a Glasgow coma scale. We're going to see if he opens his eyes. Sir? It looks like he opens his eyes to pain. Do you know what that is? That's a 2. And he's kind of withdrawing to pain here. That's a 4. And right now he can't talk to me because he's got a cricothyroidotomy. So that's, what is that? 2, 4, 7. He's 7. So he's in a coma. So we're going to, it looks like he's got a depressed skull fracture there. He's got a Glasgow coma scale of 7. We're going to need to send him to a neurosurgeon. So Kendra, when you get a chance, we're going to have to call the trauma center and get them on the line because we're going to have to move this guy.
Okay.
And then we're going to roll him. So we're going to need an additional body to help roll him also so we can keep C-spine precautions. So let's get that all cut off. Okay, guys, we've seen the front of him. Now let's roll him over and take a look at the back. We're going to need some extra hands to do a proper log roll.
And
You count it on 3.
Roll in 3, 2, 1, roll.
Okay, and I'm palpating the back here, looking for some step off. Okay. The prostate doesn't feel like it's, I can feel it, it doesn't feel like it's high right, and he's got good rectal tone. Let's get this thing out of here. Can you put those x-ray plates in for a chest and a pelvis for me, please? Okay, Liz, well, I want you to get a couple x-rays for me. Let's get a pelvis, a chest, and a C-spine film. Go ahead and develop those and bring them back to me, but when you come back, I'm going to have you get an x-ray of his femur. Okay, we got him exposed now. Let's cover him up so he doesn't get cold. Last thing we want is hypothermia. Now let's reassess our ABCs. So he's still hooked up to the ventilator. We're breathing at 12. What's his O2 sat?
97%.
97%, super. And he's gotten how much of that blood?
He's gotten 1 unit in and he's got the other unit halfway
Super,
in.
so we're making a little bit of progress there. Okay, we're ready to move on to our secondary survey. We're going to start at the top and work our way down. So let's take a look here at the head. Looks like he's got, oh goodness, looks like he's got a depressed skull fracture here. Pupils are equal and responsive. He's got a lot of crepitus in his face, a lot of swelling. Looks like he's got some facial fractures. Let's look at his neck here. Looks like his trachea is midline, our crike is in good place. His neck veins don't look distended. He's got a lot of abrasions here on his chest. I'm a little bit concerned. It feels like he's got some rib fractures here. And he's a little bit dull to percussion. He may very well have a hemothorax. I'd like to see that chest x-ray as soon as we get that back. Let me push on his pelvis here. Feels pretty stable. His abdomen, he's not really grimacing when I push on it. Doesn't feel like it's distended. I'm not too concerned about his abdomen at the moment, but it is a possible source of bleeding. Now let's look at his legs again. Those x-rays back?
They are.
Okay, let's see. Oh, good. We got him up on the monitor here. Looks like he's got blood in his chest. So he's going to need a chest tube. Okay. So we're going to clean this off real well. Now we're going to use some sterile towels here. Make sure you drape that off real well. We're going to make our incision about 2 centimeters in length. We're going to take a big clamp and actually stick it into the chest, right up over the top of the rib. Okay, now we're going to put the tube into the chest. And there it goes. I'll push this in till the last hole's in the chest. And we're going to hook this up to the thoracolex under underwater seal. And thank you, Kendra.
Thank you.
Okay, what do we got there?
Blood draining here.
A little bit of blood coming out. Super. Take a listen to the breath sounds. And what's his blood pressure doing?
His blood pressure's up to 100 systolic right now.
Great. And heart rate's 120. He's gotten almost 2 liters of blood. He's got 2 units of fluid. Looks like we got all our x-rays. We got our chest, pelvis, our C-spine x-ray. We got that left wrist. We got the femur x-ray. It looks like he's getting ready to be packaged up.
Yeah.
Did you get the trauma center on the phone?
Trauma center should be on line 2 for you right now.
Okay, super. Let me go talk to them, and you guys get him all packaged up, ready to go. Great.
Great. Thank you.
I got a guy that I really need to send to you. He came to us minimally responsive. He had gurgling respirations and obvious facial fractures. We needed to do a cricothyroidotomy on him, which we did. The other things that he has, it looks like he's got some chest trauma, probably a pulmonary contusion. He had a hemothorax on the left side. I put a chest tube in. We've also noticed that he had a depressed skull fracture on that left side as well. And he's going to need a neurosurgeon when he sees you. He also needs an orthopedic surgeon. Super. I think he probably should come by helicopter if you can send the helicopter.